Medicaid's 80-20 rule. New restrictions on funding for home and community-based services. In spring 2024, the Centers for Medicare and Medicaid Services, CMS, finalized the Medicaid Access Rule, which includes a provision that requires that 80% of Medicaid payments for most Medicaid-funded home health aid, personal care, and homemaker services be spent on compensation for direct care workers, including clinical supervisors, furnishing these services. This 80-20 rule leaves only 20% of Medicaid payments for administrative overhead or profit. The rule, which applies to home and community-based services, is anticipated to be effective July 2030. There are limited exceptions to the 80-20 rule. States administering Medicaid programs can establish a hardship exemption based on a transparent state process and objective criteria for providers facing extraordinary circumstances. States can also establish a separate performance level for small providers meeting state-defined criteria, allowing them to meet a lower minimum percentage of funds to compensate direct care workers. Exclusions from the minimum performance level calculation will include costs for training expenses, travel costs, and personal protective equipment for direct care workers. These costs can be deducted from total Medicaid payments received for these services before the direct care worker compensation percentage is determined. Without an increase in rates, the 80-20 rule may have a significant negative effect on the financial feasibility of operating HCBS. Even without the additional restrictions of the 80-20 rule, the low Medicaid reimbursement rates for these services already make it challenging for many operators to make a profit. Leading up to the effective date in July 2030, operators should keep abreast of any announcements by state Medicaid offices on the anticipated criteria for hardship exemptions and separate performance levels for small providers to assess whether they may qualify. It remains to be seen whether states will re-examine their HCBS rates in response to the rule.